Now to the very latest on the pandemic. Today, Los Angeles County reported nearly 35,000 new cases. That's actually trending down from 43,000 yesterday. 15 people died in those same 24 hours. The positivity rate is 21%. LA County health official now asking anyone who is scheduling a non-essential gathering to postpone it, especially considering that this is a holiday weekend. People will be remembering Dr. Martin Luther King Jr. Joining us right now is Dr. Suman Radhakrishna. She's Director of Infectious Disease with Dignity Health Hospital here in California. Doctor, thank you so much for your time this evening.
Thank you for having me.
You just heard the latest numbers at LA County. Is Omicron finally trending down?
Let's hope it is. We need to talk about herd immunity, which is everybody gets infected around the same time. Then they all get immune and there is no reinfection possible. Then the virus dies out. So with so many people so quickly getting infected at the same time, I'm hoping that, we have reached that herd immunity state and numbers will level off and then start to go down.
So herd immunity is still a strong possibility. We hear about so many people who've been vaccinated and double boosted, and yet they're still getting Omicron. People are not even necessarily calling it COVID anymore. They're calling it Omicron. So you still think herd immunity is a possibility?
Herd immunity to Omicron is a possibility, but herd immunity to COVID, probably not. I think we are moving into that endemic state because we already know people had Delta, people had COVID before Delta and got reinfected with Omicron. So when the immunity wanes, then there is a possibility of getting infected again. So we're moving from that pandemic, epidemic to endemic, which means it's around every so often it's going to rear its head up because the general immune response and the immunity in the community goes down. And then a lot of people fall sick. Again, the immunity goes up and it slows down.
So, Doctor, we are hearing that people have been double vaxxed, they've been boosted, and they've had COVID twice. Is that possible because of the different variants?
Different variants, and also remember, 1 week after you get vaccinated with the booster, your immune response goes up, so you're protected, but it doesn't last. We already know that. It lasts for 6 to 8 months, and then you need to get boosted again.
So what do you see, what's the timetable on the next possible shot here? Are we talking 3 or 4 months?
Let us see. As new variants come up, then we will know how frequently we need to get vaccinated. We definitely know that after the vaccine and the booster, the protection is about 6 months. And if at 6 months there isn't any dominant variant that is running around, then we can heave a sigh of relief. But this is the nature of how viruses work. People get infections during the winter months, the herd immunity goes up, and then the common colds drop off during summer months because all of us are somewhat protected because of immunity, and then it comes back. COVID's going to do the same thing.
We're a society that's so used to being vaccinated and then not getting the chicken pox or the smallpox or polio or anything like that. And that's perhaps why we're so expecting these 2 shots and the booster will take care of everything. Obviously not the case. What do you know about the next variant here, the one that they discovered in Europe?
They have just found the variant. A variant happens whenever the virus mutates. And just because it's a variant doesn't mean it is going to do something bad, because they have to be transmissible. They have to evade our immune response that we already have. So if those 2 happen, then you are in that perfect storm situation where people can get infected. The Omicron did just that. It can evade the immune response and it is easily transmissible. That's the reason why people who were vaccinated, people who were infected before are getting infected.
Advice to people over the weekend who may be gathering for the holiday weekend?
I understand, we also need for our mental health, and we've been in this epidemic mode for almost 2 years. But if you're not feeling well, don't go out, wear a mask. Whenever possible, stay outdoors. keep the gathering small, 1, 2 families, that way you have control of who is well, who is not well. Preferably the vaccinated people get together outdoors, wear your masks when you're not eating, and get tested.
And don't let your guard down. Dr. Radhakrishna, thank you so much for your time tonight. We appreciate it.
Thank you for having me.